Dear viewers, I am Dr. Shivakumar, clinical psychologist. I work at Roshni Counseling Center, Hyderabad. Today's topic for discussion is obsessive compulsive disorder. Obsessive compulsive disorder is a very peculiar disorder or a peculiar condition where people tend to do few repeated behaviors. For example, I got a patient with obsessive compulsive disorder. So the problem of the patient is she repeatedly cleans everything whatever she other touches. If somebody touches her kitchen set, she would clean entire kitchen set. If somebody is sitting in their chairs, she would clean entire chairs. If somebody is using plates and forks, and if any kind of object, if somebody touches a remote in the family, if somebody touches the remote, she would even go to clean the remotes also. So she keeps on cleaning everything. And there is another kind of condition where people keep on checking things, whether I have locked the door correctly or not, whether I have switched off the gas knob correctly or not, whether I have kept everything which is required for my office or not. They keep on checking repeatedly. So these repeated behaviors are called as compulsive disorder, compulsive behaviors. There is a very peculiar reason behind these behaviors. You see, most of us tend to do some checking, some repetitive behaviors. Maybe when you are in rush, when you are not sure whether you have took your wallet or not, whether you have took your mobile phone or not, you may tend to check your bag and see and ensure that you are carrying it. But for obsessive compulsive disorder patients, it is very difficult for them to believe even though they see it. So they repeatedly get a few thoughts in the form of obsessions, right? And as a result, they keep on checking things. And they have contaminatory kind of phobias, like you see if somebody touched something in my home and probably that have caused some germs to come into our home, and if these germs are there, it would infect our children, or it would infect me, or it would infect anyone. As a result, our health would go upset, or as a result there can be death. So they keep on exaggerating the negative outcome. You see, for you and me, if someone gives you a shake hand, you would really feel glad and you just give a shake hand. That's not a issue for you. But for a compulsive disorder, obsessive compulsive disorder patient, they may not be very comfortable to touch you. And if they touch you, so their contaminatory obsessions kick in, and as a result, they want to go and wash their hand repeatedly. You and me, when we touch something outside, and if we think that is really not clean, we would go and wash our hands, just for a moment, come out, and we get absorbed into our day-to-day tasks. But for these obsessive compulsive disorder patients, it is very difficult for them to manage this thought. The thought that I got contaminated, my hands got contaminated with some unknown germs that suffers them. As a result, they keep on doing a cleaning compulsion. And by doing this cleaning compulsion, they want to remove this thought. And they do it, like you see, there are patients who do it for 5 times, 10 times, 20 times, and there are patients who do it up to, like you see, 50 and 100 times also. They keep on using water excessively. They keep on, like you see, repeating the washing in a ritualistic way. Maybe they wash fingers, then they wash their palms, then they wash up to their elbows. So they keep on doing everything in a ritualistic way. Even if they have to sweep the home, they may do it in a very peculiar manner. Or if they have to, like you see, wash the entire home, so they may be using excessive water. So this is how it manifests. But what is the reason behind it? The reason behind it is nothing but, like you see, my hands got contaminated, or my, like you see, household got contaminated. Somebody came into our home, which, like you see, caused some unknown things to come into our home. So these are different kinds of obsessions people get, and as a result, they keep on doing this compulsive behavior. Many people who come with this condition, they think that they are the only people who get these kind of thoughts. But in general, most of us get this kind of obsessive quality thoughts. Whether I have locked my car when I'm going into my home, or when I'm going out, did I lock my door? Or, like you see, if I go outside and when I'm coming back, did I pack my bag completely, or have I left something there? So after one completes cooking, so did I completely, like you see, turn off the gas or not? So these are very usual doubts which people get. This is not uncommon, and most of us get absorbed into our works easily once we ensure that everything is all right, and we absorb into our day-to-day tasks. But for the people who are suffering with this problem, it is very difficult for them to get rid of these thoughts. They keep on thinking it excessively. They keep on exaggerating the thought excessively, and they keep on reacting to the thought so badly, so that, like you see, it is very difficult for them to get rid of these thoughts. And as a result, the thoughts are there. As long as the thoughts are there, they keep on doing this compulsive and ritualistic behaviors. So what is the best way to manage these thoughts and behaviors? Once again, cognitive behavior therapy is the best way to manage these thoughts and behaviors. And in cognitive behavior therapy, patients are taught how to manage these thoughts, because most of us get these kind of thoughts. Somehow we are managing these thoughts, and we are able to see that we are not distressed because of the thoughts. But for the patients with obsessive compulsive disorder, they cannot manage those thoughts. Maybe in the past they are able to manage, but now for some reason the way they are reacting to the thoughts is causing them to suffer a lot or causing them a lot of distress. So in cognitive behavior therapy, patients are taught, or patients learn better ways to cope with these thoughts, so that, like you see, they can see that these thoughts are not disturbing them. Typically, these cognitive behavior therapy sessions would go from 7 to 8 sessions, and sometimes they also need some relaxation trainings. So with all this therapy, patient can come out of their thought processes, like you see, obsessive thought processes, and they can concentrate back onto their work, and they can live their lives happily.